Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi. This episode is everything you need to know about fibroids. But before I get into it, the first thing I want to make very clear is that I'm not giving any type of religious or medical advice. So if you have any questions about your health, please speak with your medical provider. And if you have any questions about your religion, please ask your friendly neighborhood religious leader. It's the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am so happy to have on with me Dr. Cheruba Prabakar. And Dr. Prabakar is a board certified OBGYN and a minimally invasive surgeon. She helps women with fibroids live a life with reduced bleeding, pain, and improved fertility. In October 2022, she opened her own gynecology and surgery practice in the Bay Area, where she provides highly personalized, accessible care to women through all phases of life. She is able to provide care in creative ways in the office and via online coaching programs. She can be reached at the Fibroid Doc at gmail.com and can be found on social media at the Fibroid Doc on Instagram and YouTube. So welcome, Dr. Prabakar. I'm so excited to have you on.
Yeah, thank you so much. This is great. Thank you so much for having me. And I can't wait to chat with you about all things fibroids.
Yes. So maybe you can tell us a little bit more. So you're in the Bay Area right now. Is that?
Yes. So I actually trained in the East Coast in New York and then came out here. Yeah. I trained in Long Island and then Brooklyn and then moved out here to Oakland, California, where I was an employed physician for several years and then just started my own private practice this past fall. So I am an entrepreneur and serving women, across the Bay Area for all their gynecologic needs.
That is awesome. So, before we get into talking about fibroids, I just wanted to ask you a little bit about the storm. I know I'm a little bit concerned about you.
It's been a little crazy. We've had a lot of rain recently. I'm just looking out and for like a few minutes, it's actually not raining, but it's been raining all day, all night. Our basement got a little flooded, schools have been closed actually. For the last couple of days, it's the bomb cyclone. Yeah, it's been a little
it's awful. Yeah.
We're okay.
Good. I'm glad to hear that. Yeah. So, okay. So tell me, I have so many questions. So tell me a little bit more about what you do. I know you're a minimally invasive surgeon. So maybe you could just explain to the viewers what that means.
Yes. So I am first of all, an OBGYN. I did my residency in OBGYN and then I spent a couple of years after that training in surgical techniques. So it's a fellowship in minimally invasive surgery, and minimally invasive means accomplishing surgery with just a few small incisions. So typically when we think about surgery, we think about a big incision, like a C-section incision, or some women have an up and down incision, on their belly. So this type of surgery is done either vaginally, so no scars, or just a few incisions on the abdomen, so 3 or 4 tiny little holes through which we can remove big things like a uterus, a fibroid, a large ovarian cyst, stuff like that. So yeah, that's minimally invasive surgery. And it's focused really on the gynecologic aspects of our specialty versus delivering the babies aspect. Yeah.
Yes. Better call for sure.
Yeah, definitely. Yes, I was in the OR this morning, and after this, I'm going back to the OR to remove a large 12-centimeter ovarian mass. So
my goodness.
So yeah, it's something exciting. Yeah.
You're a busy woman. So, okay, so let's talk a little bit about maybe we can, and you can tell the viewers about what exactly fibroids are for those women that, are lucky enough
Yeah,
not to have
so our
fibroids.
uterus, or colloquially known as, the womb, is made up of smooth muscle, and fibroids are essentially balls of smooth muscle that grow on the uterus. And so they are almost always benign. Very rarely do they turn into cancer or anything like that. They're usually benign, and a lot of women don't even know they have it. But it's actually really common. 80%, 80 to 90% of all women are diagnosed with a fibroid by the time they're age 50. So it's really
Wow,
common. It's way more common than you think.
I
Yeah,
didn't know it
it's
was
really
that
common,
common.
and a lot of times you don't really go looking for it unless you're having problems, and then you're getting
Sure.
scans and other testing to find out that, oh yeah, I actually have a fibroid.
Right, right. And so maybe you can tell us a little bit more about, you talked about how with fibroids, people can have heavy bleeding. And what are some other symptoms that women may experience that have fibroids, and perhaps don't even know it?
So as you mentioned, fibroids, the number one symptom that a lot of patients have is very, very heavy bleeding. But other times patients will say they have pelvic pain, they have to go to the bathroom all the time, almost like if they were pregnant, peeing all the time.
Mm,
Painful
mm,
sex is another one. Patients
yeah.
complain of painful sex, and often this is because there's a fibroid low in the uterus or on the cervix, and this can cause a lot of pain. Other times patients will say, "Oh, I feel a ball in my belly," or when I'm sleeping, I turn around and or turn side to side, and I feel this like ball moving around in my belly. So these are some of the common symptoms that patients experience and the signs with which they come to me and say, "Oh, what's going on?" The other big one also is infertility. Patients will have
Mm,
multiple
yes.
miscarriages, um, uh, and then when it's finally being worked up, then it's found that they actually have, fibroids. So that's another one. So it's usually diagnosed in, the late 20s, 30s, right around that childbearing age.
Yeah, yeah. I know that some patients also will complain, depending on how big those fibroids are, right? They could also be complaining about like pressure that they feel, or maybe like a sense of bloating or something like that. Um,
Yes, yes.
Often that
Usually,
can happen as well.
yes, and usually by that time they're usually feeling something too. They can when they press on their belly, they're like, "Oh yeah, I feel something really hard," or that pressure is often kind of the bladder symptoms. Oh, I'm running to the bathroom all the time. And I should also mention that sometimes patients feel constipated because fibroids
Mm.
are kind of sitting on their bowel near their rectum and preventing kind of normal bowel movements. So they can have a lot of different effects actually once you think about it.
Right, right, right. So, I know you mentioned that women will often be diagnosed with fibroids, during the childbearing years. Typically, how long do you tell a woman? So, say a woman has a fibroid inside her uterus and she opts to have surgery to have it removed. Typically, how long do you tell them to wait before they conceive? And then would they be able to have, say, like a normal vaginal delivery?
Yeah, so it really depends on how big the fibroid is and where it is. So if it's actually in the cavity of the uterus, and the cavity is where a baby forms or where the tissue sloughs off, in order to get your period. So if it's a fibroid in there, we can often remove it through the vagina, right through the vaginal entrance into the cervix, and that's a procedure called hysteroscopy. And so for those procedures, the recovery is very quick. Patients go home the same day, they're fine the next day, they can go back to work the next day, and they don't really have to wait a long time before trying to conceive. So the next cycle, they're good to go. Versus if the fibroids are much bigger and they're in the wall of the uterus, then I approach those robotically. So I go from up top and remove those fibroids, and these can be anywhere from 6 to 10, 12 centimeters. So then I remove that, and those fibroids are often so big that they're going right through the wall of the uterus, in which case the patients, I recommend that they wait 6 months because we really want
Mm,
that uterine wall to heal and to really get nice and strong before it starts growing a baby. And for those patients, yes, we do recommend a C-section versus
right.
a vaginal delivery. Yeah,
Right, because you don't want her to have contractions because her uterus could
exactly.
rupture.
Exactly, because
Mhm.
once the uterus starts, as we know, in labor, I mean, the uterus can contract for days, and that kind of pressure. Even though, a patient just asked me, well, what if I get pregnant like 3 years down the road? Is that enough to have healed it? We don't really know. It's hard to do studies on this, right? Life is precious, a baby is precious. We don't want to exactly be doing, big studies on, oh, let's see what happens to your baby, right? So we
Mm,
don't have great data, but from what we know, the recommendation right now is just to avoid the vaginal delivery and just to proceed with a C-section. And we often recommend it a little bit early. So if your due date is at 40 weeks, we say do your C-section around 37 weeks. Mhm.
right, right. Okay, awesome. And, so I'm wondering, like, what role does a fibroid play specifically with regard to, say, like intimacy? What complaints do patients have? I know you mentioned that, sometimes they can have pain with intercourse. Um, what are other things that patients have come to you about?
I think the first thing is actually the bleeding. Patients
Mm,
have fibroids can cause like torrential like pores essentially. Like, I mean, people
yes.
are flooding their, tampons and their pads and their bed sheets and whatever. So it can be really, really a life-changing thing. And if they knew it was just for 2 or 3 days, that's one thing. But for a lot of women with fibroids, this goes on. This goes on for 14 days,
Yes.
15 days. So you can imagine it's very difficult to actually plan sex. Sometimes patients will plan vacations and they say, oh, okay, that's when I'm going to, let loose and I'm, planning for special intimate times with my partner. And then boom, they start bleeding over there, right? So I think the bleeding is the number one issue that a lot of women
Yeah.
face when they're trying to actually be intimate with their partners. And this is something that is not normal. Many women think, oh, okay, I just have to put up with it. I have a fibroid, like I'll just wait till menopause or whenever it starts to shrink. And I just want to encourage anybody listening, like, you don't have to suffer. So if your fibroids are causing bleeding and they are, kind of ruining life and your sex life, just go and get it, taken care of. There's so many options we have. So that's the number one. Number two is pain with sex. And so there are young patients who say, well, I shouldn't be having pain with sex. Everything's lubricated, everything's great, but I don't know why I'm having so much pain. And then we do an ultrasound and we find a cervical fibroid or a fibroid low in the uterine segment. And that's easy to fix. That's a surgical, procedure, and we can take it out and, life goes on. So there's definitely ways we can actually address those as well. But those are the two big ones I would say when it comes to kind of interfering with sex life.
Sure, sure. Yeah. And, sometimes women don't even realize how much blood they've lost, right? Until they start having shortness of breath or like an unremitting headache or something like that. And then they find out that, oh, yeah, I've been like hemorrhaging for the last like month. And
Yes.
now, I'm finally going to seek treatment. And now my blood count is half of what it should be,
Yes,
right?
yes. And I think
So it's,
a lot of women are used to that bleeding. So for them, when they come to tell me, I'm like, my eyes are popping wide and they're like, oh, well, this is how it is for me every month. And, we just get used to it. And I think they don't think like, oh, no, this is actually really abnormal.
yeah.
Yeah.
Yeah, I think women put up with a lot, right? We just
Yes.
get used to a lot of stuff and we just
Yes.
think it's normal
We
and
think
it's
it's
and it's
normal
really not.
and it's not. And a lot of
Yeah.
times in those situations, as you mentioned, when a patient gets an iron transfusion or a blood transfusion, then they feel so much better. And they're like, oh, this is how I can
Yes.
really feel. Or they get the
Yeah.
problem fixed, the fibroid taken out or
Yes.
whatever. And then they're like, oh, amazing. I just bleed 4 days a month. So,
Yeah,
yeah,
right? Right?
yeah,
Like, this is what it feels like to be alive.
exactly.
Uh, yeah. And so, I'm also curious to find out, like, when you have women, and I know you mentioned this a little bit, that have fibroids, what options do they have for in terms of like surgical options? So is it always surgery that they need, or, do they have other options? Or what would you tell somebody that came in that say that was really being bothered by her fibroids? What would you
Yeah.
typically like suggest for them?
So there are a lot of different things we can do for fibroids. Some are as simple as a birth control pill, just a quick medication that helps with the bleeding. It really depends on what the patient's problem is. If it's the bleeding, there are lots of hormonal medications to help with that. If the symptoms are really painful sex, oh, I feel like I'm pregnant, I have this big ball in my belly, well, the hormonal medications may help a little bit, but surgery is the best thing for that, for those types of symptoms. And then for patients who are trying to get pregnant, I think surgery is the best option. So we actually remove the problem, remove that fibroid, the small one, the big one, whatever it is, and just, make your cavity and your uterus nice and clean and ready to have a baby. So I think it really depends what the patient's issue is. There are some patients who have no issues and they say, oh, you know what? I was in the ER for something and they told me I have a fibroid. In that case, you actually don't need to do anything. If you're not being bothered by
Mm,
it, you're not having bleeding.
right.
I see a lot of patients come in so anxious. Oh my goodness, I have a fibroid. What do I do? But if it's not very big and you didn't even know you had it and it's not bothering you, you actually don't need to do anything. So that's another important point too.
Yeah, you're right. I mean, that's a very good point, actually, right? Because then I don't want people walking away, after listening to this episode, like, oh my God, I have to have my
Yes.
fibroids removed, or that I didn't even know I had one, but now I know I have one and now I got to get it removed.
Yep.
So
Yep.
you're right. If it's not bothersome, if it's really, and sometimes you can have fibroids that are really small.
Exactly.
So,
Yep.
and they're not doing anything. And so you really don't need to have it removed.
Absolutely. Yeah.
Um, so, say somebody's in the Bay Area, and I know a lot of people that do listen to my podcast in the Bay Area. How would they go about getting in touch with you? What type of coaching do you offer online?
Yes, so I offer a couple things. The first is fibroid coaching, and this is for anybody who is listening anywhere in the world. You could be in the US, Bay Area, or anywhere in the world. And this is a session that we have together where I really go over options, listen to your story and give you what's available out there and what may suit you. I can't really function as your doctor because you're not in California, but this is a great option for those who are kind of sick and tired of just Googling things and hearing different things. They just want some reliable answers from a physician. So this is a great option for you. And you can just email me at thefibroiddoc@gmail.com. If you are in the Bay
Mm.
Area and you actually want to be a patient, either for fibroids or just for general gynecology, you can visit my website, lamorinda.gyn.com, or you can also go to the fibroiddoc.com and that'll redirect you to my website. So those are great options, great ways to get into my practice. And certainly, if you're somebody who is desiring surgery, so you could be in the Bay Area or even in LA or San Diego, you just want your fibroid removed, you're undergoing fertility treatments or whatever it be, you just need your fibroid removed. I'm happy to also see you and take care of you in my practice.
That is awesome. That is so good to know. And that's the great thing about coaching, right? Is that because one, it's all virtual, and also that it's like international. I
Yeah.
mean, there's no, you don't have to worry about like
Yep.
state lines or anything like that. And, you can get in touch with a coach. And I think that's fantastic that you do coaching regarding fibroids, because there's so many women that don't have the proper information, right?
Yes.
And so they can access you and contact you. Do you have like, just wondering in terms of your coaching, if somebody wanted to sign up for coaching with you, is that like a membership? How does that
Yeah,
work?
it's just a one. I just go by an hourly basis. So some patients will just do an hour. Others will say, okay, I'm going to do an hour, and then when I get ready to actually do surgery, I'm going to have a lot more questions, and
Mm.
then they'll sign up for another hour. So you're not committing to anything, long term. It's just by the hour, and you just contact me, and we go from there. You'll sign an agreement, and then yeah, we go from there. And I've had patients or coaching clients from New York and also abroad who I actually had one patient who was already signed up for a hysterectomy, but she said, oh, well, whenever I go to my doctor, I barely get any of my questions answered because I feel so rushed. So I just want a coaching session just to go through all the questions, which was great for her. And then she felt so relieved and, just a lot more ready to tackle what was coming ahead.
Absolutely. I mean, and, being part of a busy OBGYN practice, you know that physicians just never have time, right? It's like they have patients scheduled every 15 minutes. They can't
Exactly.
spend that time with you. So to have a physician that has time and whose specialty is fibroids, right? That is something that's really, really important. And it helps to put their mind at ease, especially if they're about to have surgery.
Exactly.
So to know,
Yes.
what type of surgery and the recovery and all
Yep.
of that stuff. Do you get patients asking you about like what their intimate life is going to be like what their sex life is going to be like after they have surgery?
Yes. So one of the common questions that I get asked is from patients who are having a hysterectomy. And there are patients who ask, well, they should take their cervix or leave their cervix, and how this
Yeah,
plays into, their sex life and intimacy.
yeah,
And there's a host of reasons why you would leave the cervix versus take the cervix. And but if you are taking the cervix, I want to reassure patients and those listening that it does not interfere with sex life. There are big studies that have been done that show that there is no difference. And so, if you have to take your cervix for medical reasons, if you've had a history of abnormal paps, you just don't want to risk getting cervical cancer. You don't want to think about that. You never want to have a pap in your life again. Just it's okay to take the cervix. Yeah.
yeah. That's good stuff. Good to know. But also about ovaries, right? So I'm sure patients will ask you whether or not they should
Mhm.
keep their ovaries or get their ovaries removed. And, what do you counsel them? And then, of course, they have to worry about estrogen replacement
Yes.
and what to do about that. So what do you recommend?
Yeah, so I generally do not recommend removing ovaries. We both know that the ovaries give us our estrogen, that is our main sex hormone, and not only for sex, but also for our brain health, bone health, heart health, all of those things. So I do not recommend that patients remove their ovary unless, we're suspecting something bad, ovarian cancer. But otherwise, retain your ovaries and if you do have to remove it because you have a large cyst, you have something that bleeds, there's some other medical reason and surgical reason why we end up removing it, then yes, I think hormone replacement therapy is a great way to go to replace that estrogen so you can continue having a good quality of life in all of those areas. Yeah.
Absolutely, absolutely. I know that some women will, decide to have their ovaries removed because they're approaching menopause and they want to decrease their risk of ovarian cancer. And some women that have, as positive for BRCA,
Hmm.
the BRCA gene and things like that, and that are at high risk for ovarian cancer will opt to have their ovaries removed. So definitely hormone replacement therapy is a good option for those patients.
Yes. And
Um,
the BRCA
you know,
patients,
do
definitely, we want to remove the ovaries. But the menopause patients, I say, the studies really show that we shouldn't be removing ovaries until about age 65. So I have patients who need a hysterectomy at
Mhm.
49, and they're like, well, I'm about to go through menopause anyway in a couple of years. And I said, no, but you still have another decade of the ovaries really giving you good hormones. So don't remove those ovaries. I think a few decades ago, that was common practice, remove the uterus, the ovaries, everything. So now we actually really try to preserve the ovaries.
Oh, that's good stuff. And tell me, I know that some patients also worry about after they get a hysterectomy about the length of their vagina, like decreased vaginal length. Do you talk to them about that? Is that ever a concern that comes up? I know sometimes after radiation, and things like that.
Yeah, so
Um,
after surgery itself, no, your vagina should not be shortening after surgery. If anything, there's probably an increased length a little bit because we're suturing that cuff and pulling everything up a little bit higher. But if a patient actually has cancer, like endometrial cancer, and they are receiving vaginal, brachytherapy and other radiation therapies, yes, that can make the vaginal canal a lot more narrow and a little bit tighter. So, but the surgical
mhm,
portion alone doesn't do that.
mhm.
Yeah.
Yeah.
In which case, if that happens, then we suggest vaginal dilators for those patients to
Yes.
still, maintain some length and some width to the vagina so they are able to have sex if they want to. Yeah.
Right, right, and that's where, like, your pelvic floor therapists would be
Absolutely.
great and,
Yes.
help with um, the lengthening, and, those dilators make a huge difference in patients, and I think that sometimes after a surgery such as that, patient may worry about, like, pain with intercourse, and especially if they have, if they've had to have their, ovaries removed, they could have vaginal dryness, and
Mhm.
then, you would
Yes.
definitely what do you recommend for your patients with vaginal dryness
Yeah.
then?
So the vaginal dryness, if we were removing your ovaries because of some sort of a cancer, then we're not going to recommend vaginal estrogen. At this point, a lot of oncologists are not on board with that, especially for estrogen positive, receptor positive cancers. But for those patients, I would recommend non-estrogenic, lubricants and vaginal
Yeah,
moisturizers. So there's a lot out there. And then for patients who had their ovaries removed for some surgical reason that was not cancerous, then absolutely vaginal estrogen is fine. Yeah.
awesome. Well, okay, any parting thoughts that you would advise, someone that has fibroids, what they may consider, anything that you think is important, any signs or symptoms that they should watch out for that, would be a good reason to give you a call or set up an appointment with you?
Yeah, so definitely the vaginal bleeding and the uterine bleeding, that's very heavy. I want to tell patients that that is not normal. A lot of patients think that heavy bleeding during their period is normal, and of course, it's all relative for every patient. But if you're bleeding so much that you're soaking through a pad or a tampon every hour, soaking through sheets, or you're bleeding more than 5 days a month, you're bleeding 2 weeks out of the month, that is not normal. So definitely see me, see a gynecologist near you. And if you're experiencing painful intercourse and you can't really seem to figure out why, there's nothing that happened and you're like suddenly having this issue, don't be afraid to seek out care and seek out a second opinion if need be. A lot of patients will go see one gynecologist. They'll say, oh yeah, you may have you have a little fibroid, but that shouldn't really be causing it, or whatever. They're not really happy with the answer. If that's the case, then don't be afraid to seek out a second opinion.
Yeah.
Yeah.
Awesome. Awesome. Well, thank you so much, Dr. Prabhakar. I'm so happy to have you on. And I know that our viewers and our listeners all over the world are so happy to hear from you and to learn more about fibroids, and that they are not alone and they don't have to suffer. And I think that's one of the biggest takeaways I think that I take away is that you don't have to suffer. You don't have to bleed. You don't have to hemorrhage. You don't have to live a life like that, and that there is treatment, there is help. And I think just hearing that, I think gives women hope that they can do
Absolutely.
something about their fibroids. So I think that
Absolutely.
that is very, very important. So, and I'm so grateful that there are people like you out there that do minimally invasive surgery, and that you have something online, such as online coaching, that you can also guide patients. So I think that's so valuable. So thank you so much for doing what you do.
Yes, thank you so much. And also for anyone who is listening, please follow me at the Fibroid Doc on Instagram. That's a quick and easy way just to get a lot of information about fibroids and general GYN health. And you can also find me on YouTube at the Fibroid Doc. So thank you so much for
Awesome. I
having
love
me.
it. I follow you, and
Yeah,
I learned so much stuff about fibroids that I didn't know.
yeah,
So it's
yeah.
pretty cool.
Yeah, thank you so much for having me. I appreciate
Of
it.
course. Absolutely. So, well, we are done here. It's been real and really intimate. And remember, this is not meant to be any type of medical advice. So, if you're having any issues with bleeding or fibroids or anything like that, please go and see your healthcare providers so that they can properly assess you and take care of you. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.